Travel and tourism, travel bans, sporting events cancelled, mass gatherings outlawed, self-quarantine made mandatory, panic buying, gloomy economic prospect and an option of total lockdown on the table. But is Kenya ready for the length of the coronavirus pandemic in the country?
Because depending on on how we see the progress, depending on how we monitor the situation, then at the point where we think that the danger is enhanced, then you take the necessary, the committee will debate and take the necessary steps.
And with no prospect of a vaccine in the next 6 months, can Kenya's healthcare system cope with the coronavirus crisis? And as the government springs into action, how clear, consistent and concise will it be in updating the country? That's the discussion coming up next on News Compass here tonight, and we will be talking to Dr. Simon Kigondu, the Secretary General, Kenya Medical Association, and Professor Julius Oyugi, virologist at the University of Nairobi, and will make sense from the medical response and whether there is the capacity to prevent further spread of COVID-19. The hashtag later on Twitter is News Compass. Also on the program, China has shut more than 40,000 health centers and managed to contain the pandemic, which started in the city of Wuhan in Hubei province, as the death toll rises in Italy, in Europe. Border closures in Europe by the EU. But how effective will that be, from Frankfurt in Germany to London in the UK and Paris in France? And is that enough? Later, live on Skype from the city of Bremen in Germany, we'll be speaking to political scientist Dr. Louise Steinberg, and we make sense of the coronavirus pandemic from the European perspective that continues to be the attention of the Global World Health Organization, as the number now hits 235,404. 9,785 deaths and 84,960 total recovered cases across the globe. Good evening. We are streaming live on ebru.co.ke. Good morning, Kuala Lumpur in Malaysia, Seoul, South Korea. Good afternoon, Washington, D.C. in the United States of America, and Brasilia in Brazil. Good evening, London in the UK, Nairobi, Kenya, and Dakar in Senegal. 19th of March, 2020. I'm Ayub Abdikadir Abdi. Our sign anchor tonight is Joyce Wamwangi. Coming up in the next 30 minutes. Welcome to the broadcast. This is the Primetime News. Thank you for joining us. The short SMS code is 40920. The hashtag on Twitter is News Compass. Later, we'll have a discussion and a live interview within the Primetime from the city of Bremen in Germany. And we'll be speaking to political scientist Dr. Louise Steinberg from Germany to get the European perspective of the coronavirus crisis. Here in the country, CS Mutahi Kagwe has said that there are no new reported cases of the coronavirus pandemic in the country. This was part of his daily briefing to the country since the discovery of the first case of the coronavirus pandemic on Friday last week. The government, alongside the county administrations across the 47 units, is stepping up measures to ensure that Kenyans are safe, as they call on to all stakeholders to take the preventive mechanisms that have been outlined by the government in the country.
The last 24 hours, we have screened and tested another 8 cases, all of which have turned out negative. We will embark on random screening in targeted areas for members of the public, commencing this Saturday, March 21st, 2020. The exercise, to be coordinated by the Ministry of Health, will also involve other stakeholders, such as the Red Cross and security personnel, among others. The government has directed the involvement of the Nyumba Kumi leaders, sub-chiefs, and chiefs in ensuring compliance to these directives, and I'm appealing to them to stop. But because we are aware that empty appeals will not work, we will proceed to arrest a number of them just to prove our point. And of course, since they will have something to report regarding coronavirus, we'll oblige them by taking them to Bagathi, where they can report.
Still on the coronavirus pandemic, Kenyans have been called on not to travel to their rural homes after 3 more cases of coronavirus were reported in the country. This comes after the Council of Governors through Wycliffe Oparanya said that counties are not equipped to handle any outbreak as there are only 2 testing facilities that are located in the capital, Nairobi.
Washikadau katika sekta ya uchukuzi wameweka mikakati kukabiliana na virusi vya corona. Wizara ya uchukuzi imetoa agizo ambalo wametaka Wakenya kuzingatia.
Equipment and stands at the public transport stages must be frequently cleaned, disinfected.
We apologize for the mix-up. That story by Abdikadir Hashim will be coming up next here on the broadcast. Now, business owners have been lamenting on the negative effects of the outbreak of the coronavirus pandemic, which has had on their businesses. We went on the streets of Nairobi this evening to have a feel of how businesses are running in the city and the preparedness level of Kenyans at large. Here's this story by Diana Rachel Mbugwa.
Katika mikahawa iliyo
We'll be getting to that story by Diana and Abdi in regard to the coronavirus pandemic, which has had effect on the transport and businesses in the country since the discovery of the first case on Friday last week. And this story, which is up next, is in regard to private security and private personnel across the country, which are at risk of exposure of the deadly coronavirus in the country while in the line of duty. This is to ensure that the necessary measures are in place in regard to the coronavirus crisis and that pressure which was today issued. And this story is coming up next after this short break here on the program. And we'll be right back with regards to the interview, which will be coming to you live from the city of Bremen in Germany as we take stock of the coronavirus crisis from the European perspective. Now, welcome back. In regard to the top story, Kenyans have been called on not to travel to their rural homes across the country after 3 more cases of coronavirus pandemic were reported in Kenya. This comes after the Council of Governors through Wycliffe Oparanya said that counties are not equipped to handle any outbreak as there are only 2 testing facilities which are located in the capital, Nairobi.
The transport sector in the country is trying to put in place measures to combat COVID-19. Bus stops have been sanitizing passengers to reduce chances of the virus spreading. Matatu operators have been asked to limit contact with money and encourage mobile money transfers.
Equipment and stands at the public transport stages must be frequently cleaned, disinfected, and sanitized. For border service providers especially, we encourage the frequent cleaning, disinfection, and sanitization of helmets after each use, as they require close contact with faces of travelers. Aged travelers will be handled with sensitivity by providing the safest seats, remote from personal contact.
But as people move to counties and other areas, we encourage our operators not to overcharge. Please do not overcharge, or let's not take advantage of this situation.
The directive is in line with the new guidelines aimed at preventing possible spread of the coronavirus.
Operations must limit the use of cash and support the use of mobile money transfers as much as possible, given the recent measures announced by the central bank to facilitate mobile cash transfers. We do recognize that one of the challenges that we will be experiencing with public transportation, especially on frequent trips, is traceability. To assist with traceability of passengers, long-distance operators are encouraged to keep a passenger manifest with details.
Our passenger transport business is getting a big hit. You know very well that the first hit is on public transportation, where our people are traveling and where most of our staff are.
This comes after the cases of COVID-19 in the country are 7.
Ukiangalia vijana wale pia wanatafuta mapato yao ya day to day, hand to mouth. pia wanaumia. If you look at in the sector of matatu, also they are struggling with their day-to-day income.
Na maradhi yakitaka kutushika hata tukajikinga, Mwenyezi Mungu akwambia tujisaidie na atakusaidia.
It's actually very difficult for people to change overnight.
The Council of Governors has urged Kenyans not to travel to rural areas after 3 more cases of coronavirus were confirmed. According to COG Chairman Wycliffe Oparanya, counties are not equipped to handle any outbreak as there are only 2 testing facilities and they are located in Nairobi. Well, we are waiting to see if Kenyans will adhere to some of this regulation, of course, not just placed by the Ministry of Transport, also by the Ministry of Health and the government at large. Abdikadir, Ibru TV.
Now, business owners have been lamenting on the negative effects of the outbreak of the coronavirus has had on their businesses. We went to the streets of the capital, Nairobi, to have a feel of how business is running and the preparedness level of Kenyans at large. Here is Diana Rachel Mbogwa with that story.
Now, since Kenya announced its first case of the coronavirus last week, business owners have been complaining of the negative effect it has had on their businesses. And today we went to the streets of Nairobi just to find out or have a feel of how the corona outbreak pandemic has had on their businesses.
Our business has been quite slow since last week because of this corona thing. Actually, corona thing has affected our business. As you can see, our restaurant is totally empty. We've been having very full, but in terms of that corona, our business has been quite slow.
So many people went into panic, and you find that right now in CBD it's like a ghost town. Not many people are coming in, and then considering the fact that most people are working from home, it has really affected us in terms of the clients' turnover. But we are hoping that a solution will come up soon so that at least things can go back to normal.
Now, this is one of the restaurants in Nairobi which has been hit hard by the coronavirus outbreak. If you look to my right and my left, the seats are completely empty, despite the restaurant assuring its clients of serious hygiene measures put in place, and they are even preempting worse days in the coming days. Becky, who is a shop owner at the Nairobi's CBD, laments on the slow flow of customers, which has forced them to only restock once this month.
It may reduce na, let's say, like 50%. Yes, may reduce kabisa. Like hata kuingiza mzigo saizi it's hard. Yes, like tulikuwa watu wenye tulikuwa tunaingiza like kila siku, but for now tumekaa for 1 week bila kuingiza because even vitu zimekuwa expensive.
Meanwhile, in the counties, Kisii County traders have decried the closure of all markets following a directive by Kisii County government to lock down all vegetable trading markets in the devolved unit.
Tuko kikando na yeye na maoni yake, lakini sasa kuna watu wengine walikuwa wameagiza misigo yao, kuna wengine hata washaleta hiyo misigo hapa. Sasa watapeleka wapi akifunga tu siku moja pap. Hii kitu angeipea hata hii wiki moja bado ishi ama tupe masiku ama notice watu wachipange.
The directive is in line with the national government's advice restricting all mass gatherings in a bid to combat the spread of coronavirus, which has been termed as a global pandemic. The effect of the coronavirus here in the country can really be felt with less cars on the roads and ghost towns across the country. However, most business owners are hopeful that this situation will not last for long. Diana Rachel Mbogwa, Ibru TV.
Our continuing coverage of the coronavirus pandemic continues here on the program. When we come back from the break, we'll be speaking live to Dr. Louise Steinberg from the city of Bremen in Germany. Later, we'll cross over to our discussion, which will be featuring Professor Julius Oyugi, virologist at the University of Nairobi, who heads the Department of Medical Microbiology and Deputy Director at the Institute of Tropical and Infectious Disease at the University of Nairobi, and Dr. Simon Kigondu, the Secretary General, Kenya Medical Association in the country, in regard to the so far medical response the government has accorded the country and whether we can withstand the coronavirus pandemic and what lessons we can archive post-COVID-19 in revamping the country's healthcare system. The short SMS code is 40920 and the hashtag on Twitter is News Compass. After the short break here on the Primetime News. Welcome back. You're watching the Primetime News. Now, over 700,000 private security personnel across the country risk exposure of the deadly coronavirus in the country while in the line of duty. To ensure that necessary measures are put in place, the Private Security Association is now calling upon the national government and the county administrations to make available the necessary personnel equipment such as healthcare training, N95 temperature masks, and for the majority of them who have not been provided with so far. Our reporter Amelia Kisienya with more on that story.
The security guard sector in the country is among the few sectors that are on the front line in the service of the over 1 million Kenyans in the country, thus placing their lives at a great risk while in the line of duty, especially with the ongoing outbreak of the deadly global COVID virus. To ensure that their safety is accounted for, the over 700,000 security guards across the country, the Private Security Association chairman, Cosmas Mutava, now wants the national government to step up and make available the necessary personal equipment such as the N95 mask, gloves and temperature sensors.
We therefore request that His Excellency, the President, through the government of Kenya, make available and affordable to the frontline private security workforce basic health care training.
A majority of the security guards who provide these services in a 24-hour schedule have been exposed to the COVID virus, especially in institutions such as hotels, airports and other identified institutions. And upon asking if they have instilled necessary measures to the employees before the government chips in, PESAC officials had this to say.
They should be able to remove the uniforms and leave them at their place of work, put on their own civilian attire, and they make sure that they take a shower where they work before going home.
Even when they are opening your gates, keep distance. Let them not peep their heads in the vehicles as they're asking you, where are you going? That is the training we are talking about.
Delano Kilu, PESAC Secgen, also further cautioned of mushrooming dust filter mask available in the Kenyan market as not medically approved and that should be avoided, and instead called for the use of the N95 mask.
These will not prevent any form of infection. So if the use is required, and we are kindly requesting the general public to allow for the few N95 masks to be used and utilized by those in healthcare, involved in the work of medicine, as well as on the front line.
With the over 40 million Kenyans in the country ensuring their safety against the COVID-19 virus, on the other side, the security personnel in the country have also not been left out, with stringent measures being put in place to ensure their safety. Amelia Kisienya for Ebru TV.
Thank you, Amelia. From Nairobi, we head to the city of Bremen in Germany, live to join Dr. Louise Steinberg, who is joining us from the city of Bremen in Germany for status on the coronavirus pandemic in one of the European countries that is affected by the coronavirus pandemic. Good evening, Dr. Louise Steinberg. What is the latest status of Germany in regard to the coronavirus pandemic in Germany?
Well, hello, Ayub, and hello, Ebru viewers. It's nice for you to have me on your show. Well, at the moment, as you know, like in most of Europe, most countries are on lockdown. Our neighbors, most of them are on a complete curfew. Italy is on curfew, France is on a complete curfew. That means banning people from actually even leaving their own homes without permission or without a special license. Germany at the moment has sort of taken a more conservative view and is not completely locking down the entire country. There is only a certain small part in the state of Bavaria. Bavaria is one of the 16 German states that has actually installed a curfew. But Germany at the moment, we don't have a full-blown curfew. We just have restrictions as far as movement is concerned and gatherings.
Okay, in that case of the restriction, at some point the Chancellor Angela Merkel did say that 60 to 70% of the population will be affected, and you have your neighbors and other European countries, for instance, say Italy, that is in total shutdown following the directive by Prime Minister Giuseppe Conte. Is it a case of an inevitable shutdown coming your way, and how is the government managing the situation in Germany as regard being the biggest economy in Europe, and how effect has that led in terms of having it on the German economy?
Well, at the moment, yes, Germany being not only the largest economy, but also one of the most populated. We have a population of over 83 million. At the moment, we have the third largest number of infections at about 15,000, but only 43 deaths at the moment. So basically, what the German government is trying to do is more of a case of mitigation rather than containment, because the spread of the virus cannot be contained, it can only be mitigated. And even though our neighbors have already created a complete shutdown, especially Italy and France, the German government believes that the virus is already here, and it's just a matter of making sure that people don't gather, meaning you can't go to a mosque, you cannot go to a church, you cannot go to a meeting, you cannot go to gyms and the general spaces, social spaces that we are used to. They believe that at the moment, the health system is squarely able to mitigate this virus. They're able to ensure that it doesn't spread further. So we're being told constantly about social distancing, and that is what we're practicing. I must admit, though, that the Federal Chancellor, Dr. Merkel, has appealed and is depending on the goodwill of the citizens and residents of Germany to actually play their own role and not go out and do what they're not supposed to do.
Okay.
Beyond that, you asked a question about being the largest economy. Germany is also a social welfare state. That means there are nets available and cushions for the residents, for the employers, and for the businesses.
Okay. Talking about the economy, and then there's the element in regard to, of course, some aspects which are political in this nature, you being a political scientist, and that is in regard to what has happened in Italy from the onset before the government misjudged the situation, as was the case in Japan with the Diamond cruise ship in the port city of Yokohama. And I'm talking about Matteo Salvini, who used the coronavirus pandemic to fund and fuel anti-immigration, anti-refugee sentiment across Europe. And that has been growing equally at the German context with regards to the Alternative for Deutschland that is seeking to change the government in regard to Chancellor Angela Merkel's government of the refugee planning and migration in regard to Germany. Is that also a case, perhaps, in which they are making a kill out of the pandemic which is ravaging the globe?
Oh yes, obviously. With every pandemic, there is obviously growing sentiment of anti-migrant and anti-everything that is not part of what you believe is your people. That is normal in every situation. You see it in the US with the president calling it a Chinese virus. You see it in Italy. In Germany, the AfD, or the Alternative for Deutschland, which is our right-wing party, which sits in the parliament, they are trying. They are really trying. But I must say, because of people not moving up and down, it's very, very difficult for them. So most of the attacks are happening online, on Twitter, on Facebook, on social platforms. That's why you're seeing their members attacking people as much as possible. We have also had cases of people of Chinese descent being attacked, being spat on, being kicked in the trains, restaurants being attacked. But because now there's such restricted movement, it's also very difficult for them to get their message of hate out there. So in some way, that is a bit of a silver lining. Generally, the German population is quite displaying a sense of solidarity in this case, and political ideologies have taken a backseat.
Okay, and in regard to generally talking about the European context here, as per the elderly or the aging European population, Germany, for example, about 45 to 55 years of age, and then you have to put it into context of Mercedes-Benz, Volkswagen, Audi, or even BMW. That is the heart of the European economy. In regard to that, besides that, the full medical package, the medical response, how is the government attending to the elderly amongst the population who are vulnerable more than the other age groups or the age demography?
Oh, that's in fact a very good question, because we have a very large aging population. I mean, if you compare, Africa has about maybe 5% of people who are 65 years and above. In Europe, the population of 65 plus are about 20%. So they're a large group of people. What the measures that are in place right now is, first of all, money is being splashed. The government has said, we're putting money out there. We'll think about where it came from after the whole pandemic. But they're not wasting any dime. All medical professionals have been activated from wherever they are. Some even are coming out of, pensioners are coming back to work. Hospitals have been quarantined. You cannot go to an elderly people's home without prior request. You cannot take a child there. Basically what the government is trying right now, especially the entire European Union, because they're working in tandem, they're coordinating, that the supply chain remains intact, meaning the supply of not just medical supplies and medicines, but also personal protection equipment and ventilators. Those are the things they're making sure that at least they are in constant supply. There are some backlogs, but those are working. And the government has splashed as much money as possible into the health system because, as you probably know, Germany has one of the most robust health systems in the world, and they want to make sure that it works. Okay,
and the all-important point here is how the prevention mechanisms will be effected and how the virus will be kept at bay. However, I'm sure you must have been monitoring the events in Africa, and to be specific, our home country, Kenya, in regard to the confirmation of the first case on Friday last week. So far, we have total cases of coronavirus, 7 total number of cases here in the country. Do you think from where you sit, as per, of course, your analysis of the government's response so far in terms of the medical and the communication channel it has offered, is adequate and enough to contain the virus? And do you foresee a looming shutdown in our Kenyan context?
It's not a very easy question to answer because Germany, for example, we had our first case on the 27th of January. Yeah. Compare that to China, which had their first case on the 17th of November. So they had, by the time we were getting our first case, it was already nearly 2 months that China had their first case. So we were able to sort of learn from what they were doing, from what they had done, especially after they came out. China came out and said, okay, we have it, and it's now a problem. Italy, for example, had their first case 1 month after Germany on the 21st of February. But their problem, the reason why it spread so fast there is, one, because it was a bit of a holiday season, and a lot of people were in the north, holidaying in the north of Italy, and they were starting to come down back to the south to go back to their homes. And that's how it spread before it was contained. Now, Germany didn't have that problem. We just had a few cases that came in, and the minute they discovered them, they started to put in measures with immediate effect. So as far as Kenya is concerned, it is the chance of the Kenyan government to look at these cases and see what we have experienced so that they can also instill such measures. But I'm very confident in Kenya, by the way I'm seeing things going, I'm very confident that the government is doing its best.
Okay, Dr. Louise Steinberg, in the best interest of time, we have to leave it there. Thank you for joining us from the city of Bremen in Germany, live on Skype in regard to the coronavirus crisis in Europe. And as they say in Germany, danke. We'll talk to you again here on the program.
Danke, keep well.
Okay, thank you so much. Asante sana. And that is Dr. Louise Steinberg, who was talking to us live from the German city of Bremen in regard to the European context of the coronavirus pandemic, as the death toll continues to rise in Italy, and other countries that have been affected equally are Germany, Spain, the UK, Belgium, Denmark, Sweden, Switzerland, and the other European Union countries. In that regard, though, we end the primetime news here. And when I come back, before I talk to Dr. Julius Oyugi, virologist at the University of Nairobi, and Dr. Simon Kigondu at our Kenyan context, at the Kenyan level, what we can learn in terms of our medical response, whether the government needs to establish a communication channel in speaking with Kenyans, not to, and that is in regard to establishing a symbiotic channel of communication, and whether that can be accurate, concise and clear, and to what effect as measures are put in place or in effect to ensure that the pandemic is kept at bay. The hashtag on News Compass, on Twitter's News Compass. Later I'll sample some of your feedback, and before we start the discussion, I'll give you the geographic outlook, the numbers so far as per the tracking done by Johns Hopkins University, and the global outlook with regards to now the European Union becoming the focus and attention of the World Health Organization, WHO. Of course, its Director General is Dr. Tedros Adhanom Gabriel Seuss. After the short break here on the Primetime News, stay up for the discussion on News Compass.